What if the checkup you thought was protecting your health was slowly harming it instead? It's a chilling question, but one more seniors need to start asking. New studies show that up to 37% of medical tests in people over 70 lead to unnecessary procedures, complications, or even surgery. And the worst part? Most of these tests are considered routine. In today's video, we're exposing 5 common checkups that could be quietly draining your health, your energy, and your peace of mind. From misdiagnosis to emotional distress, these well-intentioned screenings may lead to treatments you never needed and lifelong side effects you never expected. So before you roll up your sleeve for another test, you need to hear this. Comment your age and country. Have you or someone close to you ever regretted a medical test? Subscribe and stay informed, because your health deserves clarity, not confusion. Let's dive in. Number 1. Brain MRI for memory loss. After 70, it's natural to experience occasional forgetfulness, misplacing keys, forgetting a name, or losing your train of thought mid-conversation. But for many seniors, these small lapses bring a wave of fear. Is this the start of dementia? In response, many doctors quickly recommend a brain MRI to investigate memory issues. While the test sounds reassuring, the reality is more complex and often more harmful than helpful. Brain MRIs are detailed scans designed to reveal abnormalities in the brain's structure. But in older adults, most findings are simply signs of normal aging, slight shrinkage, white matter spots, and minor changes that do not indicate disease. The problem is that once these age-related changes are seen on a scan, they're often treated as serious red flags. This can trigger unnecessary panic, lead to a series of additional tests, and even result in invasive procedures like spinal taps or exploratory brain biopsies, all without improving memory or outcomes. A 2021 study published in Neurology Today reviewed over 3,000 brain MRIs in adults aged 70 to 85 with mild memory complaints. An overwhelming 86% showed abnormalities, but only 3% of those findings were linked to an actual, treatable condition. Alarmingly, 12% of these patients underwent invasive follow-up procedures based solely on vague or non-concerning scan results. This highlights a disturbing trend. Most seniors are being tested more than necessary, with little benefit and significant risk. Instead of rushing into high-tech imaging, the safer and more effective first step is a simple paper-based cognitive screening test. These tests evaluate memory, attention, and problem-solving skills in a non-invasive, low-cost way, and provide a much clearer picture of cognitive health without the emotional toll. Even better, there are powerful lifestyle strategies to support brain health naturally. Prioritizing high-quality sleep, staying well hydrated, engaging in brain games or puzzles, and maintaining regular social interaction have all been shown to improve cognitive function in older adults. Unless there are serious neurological symptoms like seizures, sudden personality changes, or rapid mental decline, most seniors do not need a brain MRI for mild forgetfulness. In many cases, these tests create more questions than answers, and can set off a chain of medical anxiety and procedures. Your brain is not a problem to be solved with a scan, it's a system to be supported with care, attention, and smart decisions. Number 2. Bone density scan. At first glance, a bone density scan, often called a DEXA scan, seems like a smart, simple step toward protecting your health. It's painless, quick, and promises to reveal whether your bones are at risk of fractures. But after age 70, this routine checkup can quietly do more harm than good. Bone density naturally declines as we age, just like we lose skin elasticity or muscle mass. That doesn't always mean something is wrong. Yet these scans often diagnose low bone density, referred to as osteopenia or osteoporosis, even when it poses no immediate threat. The real concern arises when seniors are prescribed aggressive medications like bisphosphonates to fix a problem that may not need fixing. These drugs can carry significant side effects, including jawbone necrosis, a rare condition where the jawbone deteriorates, along with severe acid reflux, esophageal irritation, and paradoxically, bones that become more brittle and prone to fracture over time. According to a study published in the Journal of the American Geriatric Society, the impact of these drugs in seniors is minimal at best. The study followed over 1,200 women over the age of 70 and found that bisphosphonates reduced fracture risk by a mere 0.3% over a span of 5 years. In other words, the risk reduction is statistically small, especially when compared to the likelihood of developing side effects. The problem isn't the scan itself, it's what follows. Too often, numbers on a screen lead to fear-based decisions, pushing seniors into long-term drug use for conditions that might never have caused an issue in the first place. There is a better path, one that empowers rather than alarms. Instead of relying on medications, focus on proven, low-risk interventions. Weight-bearing exercises like walking or light resistance training can significantly strengthen bones. A calcium-rich diet, including leafy greens, dairy, and calcium-packed foods like sardines, supports bone health from within. And vitamin D, whether from sunshine or supplements, plays a vital role in helping your body absorb that calcium effectively. According to a 2022 report in Osteoporosis International, these combined lifestyle approaches can reduce fracture risk by more than 20%, far more impactful than what medication alone can achieve. If you're over 70 and haven't experienced falls, fractures, or mobility issues, think twice before saying yes to a bone scan. Because sometimes, doing less testing leads to more living. Number 3. Cardiac stress test. The cardiac stress test is one of the most frequently ordered heart exams for seniors, especially when they mention feeling a little more tired than usual or experiencing occasional chest tightness. It's designed to simulate exercise, either by walking on a treadmill or through medication, to evaluate how your heart responds under stress. The goal is to detect blockages or early signs of heart disease. On the surface, it sounds proactive and preventative. But for adults over 70, especially those without clear cardiac symptoms, this test can set off a chain reaction of unnecessary and risky procedures. That's because the stress test has a high rate of false positives in older adults, up to 40%, meaning the results often suggest a problem when there really isn't one. These false alarms frequently lead to follow-up tests like invasive angiograms, the placement of stents, or even bypass surgery, none of which may actually be needed. A major study published in JAMA Cardiology in 2017 found that over half of all stents placed after referrals from stress tests provided no real benefit to patients. In fact, patients who received these procedures showed no improvement in survival or quality of life. What they did experience, however, were increased risks, bleeding, kidney damage from contrast dyes, prolonged hospital stays, and the emotional burden of being labeled with a serious heart condition they might not have had. And all of this often begins with a vague symptom like fatigue, which, more often than not, could be attributed to dehydration, poor sleep, or natural aging, not a heart blockage. For seniors without classic signs of heart disease, like chest pain during exertion, sudden shortness of breath during light activity, or a significant drop in energy, there are safer, smarter ways to assess heart health. A resting EKG can check your heart's rhythm while you're relaxed, and a coronary calcium scan uses low levels of radiation to detect dangerous plaque buildup in your arteries. Both are far less invasive, more accurate for screening purposes, and far less likely to result in unnecessary procedures. When it comes to your heart, knowledge is power, but only when it's used wisely. If you're not showing clear warning signs, a stress test might not be the safeguard you think it is. In fact, it could turn a small concern into a medical spiral you didn't need. Number 4. Colonoscopy after 70. The colonoscopy is often seen as a gold standard screening tool for preventing colon cancer. It uses a small camera to examine the colon for polyps or abnormalities and has saved countless lives when used appropriately. But after age 70, especially beyond 75, the benefits of routine colonoscopy begin to decline, while the risks steadily increase. The preparation alone can be hard on older adults. Harsh laxatives used to empty the bowels can cause dehydration, dizziness, and even kidney issues, particularly in those already managing blood pressure or fluid balance. Then comes the sedation, which poses another challenge. Older brains are more sensitive to anesthetics, and research has shown that cognitive function can decline temporarily, or even permanently, in some seniors after sedation. And those are just the risks before the procedure even begins. Once the scope is in, there's a small but significant chance of complications like bleeding, colon perforation, or irregular heart rhythms, especially in frailer individuals. A 2019 study published in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older and found that for every 1,000 colonoscopies performed in adults over 75, only 2 lives were saved, while more than 20 people experienced serious complications. That's a risk-to-benefit ratio of 10 to 1, clearly calling into question the value of routine screening at that age. Even when polyps are found, many are small, slow-growing, and unlikely to pose a threat in the person's remaining lifespan. Removing them can sometimes do more harm than simply monitoring, especially if the procedure itself causes injury. This is why leading medical organizations are updating their guidelines. The U.S. Preventive Services Task Force, USPSTF, now recommends ending routine colon cancer screening at age 75 for most individuals, especially those with no symptoms or strong family history. There is a safer, easier alternative for seniors who are still in good health and want to continue screening: the FIT test, fecal immunochemical test. It's done at home, requires no prep, no sedation, and still detects hidden blood in the stool, a potential early marker of colon cancer. It's a practical way to stay proactive without the physical toll of a full colonoscopy. At this age, prevention should be gentle, not punishing. Knowing your options and your limits is the key to smart, safe healthcare beyond 70. Number 5. Full-body CT scans. Full-body CT scans have been heavily promoted by private clinics as the ultimate preventive tool, offering to detect hidden cancers and silent diseases before symptoms appear. For many older adults seeking reassurance, the offer sounds tempting: one scan, total peace of mind. But the reality is far more dangerous than advertised. These scans expose the body to an enormous dose of ionizing radiation, equivalent to up to 500 chest X-rays in a single session. That's not just excessive, it's potentially harmful. A major 2023 study published in JAMA Internal Medicine found that the widespread use of CT scans, particularly when done routinely and without symptoms, could be contributing to up to 5% of all cancers today. That places them in the same risk category as daily alcohol consumption, a sobering comparison for something marketed as preventive. What's worse, full-body scans often uncover benign, age-related findings like tiny nodules, calcifications, or cysts that pose no real threat. But once these are detected, they raise unnecessary alarms. Patients are frequently referred for additional scans, invasive biopsies, or even exploratory surgeries, procedures that carry their own serious risks, including infection, bleeding, and organ damage. And in the vast majority of cases, these follow-ups lead nowhere. There is no compelling evidence that full-body CT scans improve survival or reduce serious illness in asymptomatic people, especially seniors. This is why expert guidelines are clear. The American College of Radiology explicitly advises against full-body CT scans as a routine screening tool in healthy individuals. They emphasize that imaging should be targeted and symptom-driven, not a catch-all solution looking for a problem. The only time such scans should be considered is when there are specific warning signs, such as unexplained weight loss, coughing up blood, persistent swelling, or pain that doesn't resolve. In those cases, a focused scan on a specific body part may be helpful, but scanning the entire body just in case is like fishing in the dark, with a net made of radiation. For seniors, especially those feeling well, these scans can be more harmful than helpful. The best approach? Stay alert to real symptoms, keep regular checkups with your doctor, and avoid being lured into expensive, high-risk screenings that promise peace of mind, but may instead rob you of it. When it comes to your health, more testing isn't always better, sometimes it's just more dangerous. Medical tests can be life-saving when done for the right reasons, but life-altering when done without clear purpose. After 70, the goal isn't just to detect problems, it's to protect your quality of life. So before saying yes to any test, ask your doctor, if this test finds something, then what happens next? If the answer sounds vague, risky, or unnecessary, it might be time to pause and reconsider. Your energy, time, and well-being are too valuable for guesswork. Real prevention doesn't come from machines, it comes from how you live each day. Eat whole, nutritious food. Stay active. Get restful sleep. And focus on the screenings that matter most for your personal risk, not what's marketed to everyone. Have you ever regretted a test or procedure? Share your story in the comments, we're listening. Like, share, and subscribe for more honest, senior-focused health advice. Your clarity starts here.